All right, so my presentation will be on the manifestations of alcohol withdrawal. Introduction. Effects of alcohol withdrawal can start anywhere from 4 to 72 hours after one's last intake of alcohol. This depends on the client's frequency and amount of alcohol intake. Withdrawal effects can last between 5 to 7 days. Manifestations or symptoms of alcohol withdrawal include nausea, vomiting, tremors, restlessness, or the inability to sleep, known as insomnia, depressed mood or irritability, increased heart rate, respiratory rate, blood pressure, and temperature. A normal heart rate is between 60 and 100 beats per minute. A normal respiratory rate is between 12 to 20 breaths per minute. Blood pressure is normally between 90/60 and 120/80. And a normal temperature reading would be from 96.8 to 100.4. Diaphoresis or sweating, tonic-clonic seizures, and illusions. Alcohol withdrawal delirium can occur 2 to 3 days after a client has stopped drinking alcohol and is considered a medical emergency. These findings include severe disorientation, psychotic manifestations, including auditory and visual hallucinations, severe hypertension, and cardiac dysrhythmias that can lead to death. Benzodiazepines are the first line of treatment of alcohol withdrawal. Intended effects include putting the vital signs within normal limits, decreasing the risk of seizures, decrease the intensity of withdrawal manifestations, and examples of benzodiazepines are chlorodiazepine, diazepam, lorazepam, clorazepate, and oxazepam. Nursing actions that should be followed when administering benzodiazepines include administering the medication around the clock or as needed, obtaining baseline vital signs, monitoring the vital signs and the neurologic status on an ongoing basis, and maintaining seizure precautions. Examples of maintaining seizure precautions was watching the patient, making sure that they do not fall. And with the neurological status, you can make sure that the patient is not confused. Question number 1. A nurse is assisting with a staff education session to discuss medications used during the care of a client experiencing alcohol withdrawal. Which of the following medications should the nurse include in the discussion? Select all that apply. Give you guys about 10 seconds. All right, let's see what the answer is. Lorazepam and diazepam. Lorazepam and diazepam are benzodiazepines used during alcohol withdrawal to decrease anxiety and reduce the risk for seizure. Question number 2. Nurse Tara is teaching a community group about substance abuse. She explains that a genetic component has been implicated with which of the following commonly abused substances. Give you guys a few seconds to answer this. Alcohol. Several chromosomes have been implicated in increased vulnerability to alcohol abuse. Statistics have shown that the risk for alcohol abuse in first-degree relatives of alcohol abusers is as high as 40 to 60%. Most of the genetic research has been done related to alcohol. Definitive data regarding genetic transmission is not available at this time for barbiturates, heroin, and marijuana. Question number 3. The community nurse practicing primary prevention of alcohol abuse would target which groups for educational efforts? 10 seconds. All right, the answer is adolescents in their late teens and young adults in their early 20s. High-risk groups for alcohol abuse include individuals between 18 and 25 and the unemployed. There is no evidence that elderly men in retirement communities have increased rates of alcohol abuse. Men have 2 to 3 times increased risk than women of abusing alcohol. Question number 4. A nurse is assisting with a staff education session to discuss the manifestations of alcohol withdrawal. Which of the following manifestations should the nurse include? Select all that apply. 10 seconds. All right. The answer are nausea, illusions, and increased blood pressure. Again, as stated in a previous slide, we stated some symptoms of alcohol withdrawal. They include nausea, vomiting, tremors, restlessness, or the inability to sleep, depressed mood or irritability, increased heart rate, respiratory rate, blood pressure and temperature, diaphoresis, tonic-clonic seizures, and illusions. Question number 5. A charge nurse is discussing with a new nurse about the interventions used when administering benzodiazepines to a client who is experiencing alcohol withdrawal. Which of the following should the charge nurse include in the discussion? Select all that apply. And just giving you guys some more seconds. All right. Obtain baseline vital signs, maintain seizure precautions, and monitor neurologic status. As stated in a previous slide, we said that the nursing actions that should be followed when administering benzodiazepines are administer medication around the clock or as needed, obtaining baseline vital signs, monitoring vital signs and neurologic status on an ongoing basis, and maintaining seizure precautions. Those are my references, as I use 2 reliable sources. And that is the end.